Welcome to Lesson 8. In this lesson, we will study Chapter 4 of ICD-10-CM, which covers endocrine, nutritional, and metabolic diseases, coded from E00 through E89. Diabetes mellitus overview. Diabetes mellitus codes are combination codes. Each code identifies three things together: the type of diabetes, the body system affected, and any associated complications. You may assign multiple diabetes codes if needed to describe all complications, and sequencing is based on the reason for the encounter. Diabetes mellitus categories. ICD-10-CM classifies diabetes into 5 main categories. E08 for diabetes due to an underlying condition. E09 for drug or chemical-induced diabetes. E10 for type 1 diabetes. E11 for type 2 diabetes. And E13 for other specified diabetes mellitus. Type 1 diabetes mellitus. Type 1 diabetes usually develops before puberty, which is why it is often called juvenile diabetes. However, age alone does not determine the type of diabetes. Always rely on provider documentation. Presymptomatic type 1 diabetes. Codes E10, A are used for presymptomatic type 1 diabetes. These codes apply when diabetes is identified before symptoms begin. This must be clearly documented by the provider. Type 2 diabetes in remission. Code E11. A is assigned when type 2 diabetes mellitus is documented as in remission. The term resolved does not mean remission. If documentation is unclear, the provider must be queried. Diabetes type not documented. When the type of diabetes is not documented, the ICD-10-CM default is type 2 diabetes mellitus, code E11. This is a very common CPC exam question. Diabetes and medication use. If the documentation does not state the diabetes type, but the patient is using insulin, you still assign E11 type 2 diabetes mellitus. In addition, you must assign Z79 codes for long-term medication use. Z79 codes explained. Use Z79.4 for long-term insulin use. Use Z79.84 for long-term oral hypoglycemic drugs. Use Z79.85 for long-term injectable non-insulin antidiabetic drugs. Combination therapy coding. When multiple treatments are used, assign all applicable Z79 codes. For example, oral medication plus insulin requires 2 Z79 codes. The same rule applies for injectable non-insulin drugs. Temporary insulin rule. Do not assign Z79.4 if insulin is used temporarily during an encounter to control blood sugar. This rule applies to both type 2 and secondary diabetes. Diabetes in pregnancy. Diabetes in pregnancy and gestational diabetes are not coded from Chapter 4. They are coded using O codes from Chapter 15. Always refer to Section IC-15. Insulin pump malfunction. Insulin pump malfunctions require multiple codes. There are 2 scenarios: underdose and overdose of insulin. Insulin underdose due to pump failure. For underdose, assign T85.6 as the principal code for pump malfunction. Then assign T38.3x6 for underdosing of insulin. Also assign codes for the type of diabetes and any complications. Insulin overdose due to pump failure. For overdose, assign T85.6 first for pump malfunction. Then assign T38.3x1 for accidental poisoning by insulin. Sequencing is very important for exams. Secondary diabetes mellitus. Secondary diabetes is always caused by another condition. It is coded using categories E08, E09, or E13. Examples include pancreatic disease, medications, or surgery. Causes of secondary diabetes. Common causes include cystic fibrosis, pancreatic cancer, pancreatectomy, drug adverse effects, and poisoning. Medication use in secondary diabetes. If the patient uses insulin or antidiabetic drugs long-term, assign Z79 codes. Do not assign Z79.4 if insulin is temporary. Sequencing secondary diabetes. Sequencing depends on the tabular list instructions. Always follow code first, and use additional code notes for E08, E09, and E13. Post-pancreatectomy diabetes. For diabetes after pancreas removal, assign E13 as the principal diagnosis, E89.1 for post-procedural hypoinsulinemia, and Z90.41 for acquired absence of pancreas. Drug-induced diabetes. Secondary diabetes may result from adverse drug effects, poisoning, or sequela. Follow section IC19, E and IC20 for correct coding. Obesity overview. Obesity is coded under category E66. Codes may describe the cause of obesity or the effects of obesity. Obesity code examples. Examples include drug-induced obesity, morbid obesity with hypoventilation, genetic obesity, and obesity complicating pregnancy. Obesity class codes. Obesity class codes are found in E66.81. They require a fifth character and must be documented by the provider. Obesity class rule. If both class 3 obesity and morbid obesity are documented, assign only class 3 obesity because it is more specific. Exam focus tips. Remember these exam points. Diabetes codes are combination codes. Default diabetes type is type 2. Z79 codes are for long-term use only. Pregnancy diabetes uses O codes. Sequencing matters. Common exam mistakes. Avoid coding resolved as remission. Do not forget Z79 codes. Do not assign Z79.4 for temporary insulin. Always check sequencing in secondary diabetes. In this lesson, we covered diabetes categories, medication usage rules, secondary diabetes sequencing, and obesity coding guidelines.